What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, September 10th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Each and every day I do a 15 to 20 minute video, kind of like a podcast, where we talk about COVID and other viruses. We talk about the levels, we talk about new COVID variants, COVID studies, anything and everything you need to know to help keep you informed and prepared for what's going on. Today we're going to do just that. We're going to take a look at some news stories. Then we are going to take a look at some data, even some wastewater today. I think we will get to some COVID wastewater sites and a little bit of state data as well. So if you're new to my channel, hit that subscribe button down below, hit that notification bell, hit that thumbs up, share this video with anyone you know, and of course, leave your comments down below. Alrighty, yesterday, after we completed the Monday edition of the Pandemic Update, I was alerted to the fact that the New York City mayor, that's right, Eric Adams, has tested positive for COVID. This is not his first case of COVID. His first case of COVID, which you can actually view over on my website, datareport.info, does date back to just a couple years ago, where he had COVID on his 100th day in office. So yet again, he has tested positive for COVID. And as you may know, or you may not know, there has been a lot of talk going on about Eric Adams lately. There's an investigation going on within his administration. I don't know the full details, but he's been in the news a lot lately. And with that, well, now that he's positive for COVID, things have to be scaled back with him. Alrighty, moving on to this. New report, COVID, more severe, longer lasting than other respiratory diseases. Now, I'm not sitting here saying, oh, COVID has become more severe again. I'm just telling you that, hey, for viruses like flu, COVID is more severe than the flu. COVID is killing more people than the flu. I mean, just last week, we had 1,555 deaths reported in the United States. Can't say that about the flu, can we? Flu has barely even gotten going yet, and it won't for several more weeks. But, yeah, COVID is a much more severe disease. It's the leading cause of death among respiratory viruses, so that's not a good thing at all. Moving on to this, in North Carolina, a child has become the state's first case of measles in 6 years. Yes, they're dealing with a case of measles in the state of North Carolina. All the stories that you see today, including the last long, which was probably a study, you will see on my website. I will post a thread for today's news stories. Speaking of measles, in Oregon, they're now up to 31 cases of measles recorded so far this year. This is the most cases reported in a generation. What they mean by that is it's the most cases that they have reported since 1991. Yeah, we've been going backwards here in the United States and other countries too with measles. It's just not very good what's happening with that. Alrighty, I mentioned this yesterday, and I think we should go back to this once again. There have been some more votes that have come in on a poll that I took on my site, or on X yesterday, not my site, on X. And I put, for those who want the Novavax booster shot, are you having issues finding it? Some comments on the poll may get used in today's pandemic update. And on this poll, there were 705 votes. That's the final results. And 94.5% said yes. 5.5% said no. And I did see a lot of comments from people in the UK or other countries, and some said, well, you should have done it by country. I get that, but you know how many countries would have had the list on there? It would be far too many. And the vast majority of you said it's not available yet at your local CVS, your local pharmacy, you're waiting for Costco's or wherever. My story is, I did call a pharmacy here in southeast Pennsylvania. It's called the Skip Pack Pharmacy. And I didn't actually speak to anyone. I listened to, they had a recorded message. I'm going to call later in the week and actually speak to someone. And their message is that they're going to be getting in the Novavax vaccine, but they don't know when it's going to be coming in or when they're going to get the updated Novavax booster. So they are going to get it, and you can go on their website and you can actually fill out a form for an inquiry form stating that, hey, you do want to be notified when the Novavax vaccine comes in. So I'm going to do that as well. Alrighty, moving on to heat-related illnesses. And there have been an increase in heat-related illnesses in parts of the Midwest where, weather has been hot. There's also been an increase in parts of the Pacific Northwest, including Northern California and especially Oregon. You can see here the heat-related illnesses are much higher than average. And Great Lakes, I said Midwest, I should more so say Great Lakes. Take a look at this. There's a lot of counties dealing with heat-related illnesses. So that's not a good thing. Taking a look at the national pollen levels, let's refresh this. 32% of the country is in the medium status. Here in the Northeast, we're in the low to near medium status. Much of the central region is in the red. Red is bad. If you're in the red area, you want to be taking your allergy medicine. The West Coast is not bad. California is moderate, medium. But take a look at the Pacific Northwest. Not as bad as you were in the spring. You're actually doing really well. You're seeing some darker greens show up there, which is a good thing. Pollen levels, they continue to be a problem. The Pacific Northwest is really bad. I'm saying pollen levels. We just did pollen levels. Air quality levels continue to be bad. And take a look at this. They've actually spread east a little bit. I'm concerned. You can see Oregon, Idaho, Wyoming, Montana, but now the Dakotas are back into play. My hope is that does not continue to spread southeast, down to Wisconsin, down to Illinois, and, back to the Mid-Atlantic. We've seen this happen already this year. Hopefully that won't be the case again. I'll be looking at computer models. I'll give you a better idea if that could happen tomorrow. Alright, want to learn more about the climate and weather? I'm going to be doing some tweeting here later on because there is a tropical system in the Gulf. It's going to become a hurricane this evening. Climate Data Report over on X is the place for that. Philadelphia yesterday, not happy about this. Back up to 847 EMS incidents and 164 fire incidents. We're not too much concerned about the fire incidents, but it's the EMS incidents. They went up again, and doing a live look in right now, yeah, there's a lot of calls this afternoon. Wow, 21 calls. It's been in above 15 for several hours now, and it's just a large range of calls. Cardiac emergencies, respiratory emergencies, unconscious subject, nauseous vomiting. A lot of different things going on right now. That's not good. Hey, look, it dropped to 20, but again, it is busy. And it's also busy in Chester County, Pennsylvania. Unresponsive person, abdominal pain, seizures, fall lithosis, sick person, fall lithosis, fall, respiratory, hemorrhaging, emotional disorder, seizures, on and on it goes. And we did get an update out of Pennsylvania. Just not all of these counties that we're looking at here. Yeah, it's gray once again, meaning insufficient data in Montgomery County and even portions of, I believe that's a portion of Delaware County. No, that's Montgomery County as well. I don't get it, but here's what we do know. Things are increasing in portions of Chester County, at least in the southern Westchester site, and northern Westchester County is seeing a decrease at this time. When we take a look in northeast Pennsylvania, we do note that there is an increase in East Stroudsburg, Monroe County. That's the Pocono Mountains. They are seeing an increase at this time. There is also an increase going on in Center County, Pennsylvania. That's State College, that's Penn State University. And there is an increase going on in Mercer County, Pennsylvania. Things that were increasing last week, such as Erie County, well, now there's no change. So it's stabilized, but it's elevated now because remember, it did go up over the last 15 days. That's what the orange means. But this yellowish color, no change. So no change in Pittsburgh. So it's not decreasing. It's also not decreasing across the capital region of Pennsylvania either. Let's take a look at what's going on with the viral activity levels in portions of Canada. COVID is moderate at this time. Flu A is low. Flu B is not detected. RSV is low, and I can tell you this much. Flu B has not been detected for quite some time. I don't know if that's a data issue or it's just really not being detected. Let's take a look at a few of those Walgreens states now. Walgreens did have an update this week, and let's see what's going on here with that. National positivity rate is 29.9%. That is down by 3%. The prior week is 32.9%. Total test, 10,030 versus 13,537. You can see here on the chart, the positivity rate is clearly dropping, and it's dropping with testing being down, meaning the United States has peaked on Walgreens data and is now dropping. So let's take a look at the COVID positivity rate across a few states, and we'll look at Virginia. Today is Virginia Day. What I mean by that is their dashboard updated, and they're actually switching over to a new dashboard. The old one's being retired, and they're switching to a new one. I actually have the new dashboard up. There are a couple changes. Not a whole lot different, but there are definitely some things that changed on it. And maybe, you know what, maybe it's more different than what I'm saying. I don't know. I haven't looked at everything. I looked at just what I usually show on video. Virginia's positivity rate is 31.2%. The prior week was 30.4%. That's up by 0.8%. Total test, 263 versus 424. Yeah, that's a big decrease in testing. That's why your positivity rate's up, because you'll see when we go to Virginia's dashboard, there actually is some good news. Let's go to your western neighbor, Kentucky. I'm seeing green there. Positivity rate in Kentucky is 29.3%. The prior week was 37.1%. That's a difference of down 7.7%. Total test, 167 versus 232. That is a legitimate drop. Illinois, you're dropping as well. You're doing well. 30.6%. That is still a high COVID positivity rate, but it came down by 6% because last week was 36.6%. Total testing's down 818 versus 993. That is a legitimate drop. Let's go to the west a little more. Missouri positivity trend is 24.9%. The prior week was 32.6%. Difference of down 7.7%. Total test 229 versus 298. Now let's go, how about we go down to the south? What's going on in Mississippi? Shall we? There we go. Mississippi this week. The positivity trend is 22.5%. The prior week was 19.8%. Difference of up 2.7%. Total test, 80 versus 101. Your testing drops, so that's what your issue is. Florida, 29% positivity rate for COVID this week. The prior week was 31.2%. Difference of down 2.2%. Total test, 1,135 versus 1,358. All right, let's take a look at some wastewater data. There's a few things I want to look at here. We'll start off with some of the regional views and national view. Then we'll just randomly click on a few wastewater sites. First off, I wanted to show you the Midwest. Take a look at this. It was starting to drop. Now there's kind of like a hook where, you know, like a fishing hook, how it goes upward. Take a look at that. Yeah, it's starting to go up a little bit again for COVID levels. So not sure what that's about. We'll have to keep an eye on it. And it's not one of those wonky movements, because this is several movements that have gone upward now on updates. RSV is low. Influenza, it's not much of an issue at this point. Influenza B is low, HMPV is low, norovirus starting to see a little bit of an increase, so we'll have to keep an eye on that. Nationally, let's take a look at the nationwide level. Nationally, overall, COVID is dropping at this time. RSV is dropping. Influenza A, nationally, a little bit of a rise, so we'll have to see if that is the early stages of something. Influenza B, not much of an issue. HMPV, not much of an issue. And the last few updates for norovirus have started to go up once again, so we will obviously have to keep an eye on that. Let's go down to Harrison, Arkansas, and see what's going on there. COVID, it was dropping, then it leveled off, and now it's risen just a little bit, so that's something we'll have to keep an eye on, that little bit of a COVID rise. Not terribly concerned just yet. Influenza A, Influenza B, RSV, HMPV, and even norovirus is low. I'm happy to see norovirus low. Back in the spring, I believe it was, earlier this year, they had a huge norovirus issue in wastewater there. Memphis, Tennessee, what's going on there? Your COVID levels, they're not being calculated, but they look relatively low at this time. RSV, Influenza A, Influenza B, HMPV, and norovirus, all low at this time. Let's do another wastewater site. Let's do one in the Northeast. Let's see what's going on up in Montpelier, Vermont. That is the capital of Vermont. We'll do one here, and we'll do one on the West Coast, then we will move on. Montpelier, take a look at this. You can see COVID levels, it's saying high, but it does, yeah, this is high. You can see here it is, actually it's on most recent update, a little wonky movement upward, so it's not really dropping at this point. RSV, influenza A, B, HMPV, all low. Norovirus, you got an issue going on here. It did rise and it hasn't dropped yet. Anything else going on? Nope, no Mpox detected, so that is good. Let's go out to the West Coast, United States. Tell you what, let's go way west. Let's go out to Hawaii, because we did not do that on Wastewater Sunday. I want to know what's going on with Honolulu. Let's take a look here. And in Honolulu, COVID levels, they're now listed as medium, not high anymore. That's a good thing. RSV, influenza A, influenza B, not much of an issue. HMPV is low. Whoa. Look at your norovirus levels. They have skyrocketed to near 100,000 pathogens, but it has started to drop. But again, they're very high. Be careful if you're out in that area. Alrighty, moving on. Let's take a look at New Jersey for today. New Jersey comes in with 475 hospitalizations. 69 out of 70 hospitals is being reported. That is a drop. 12 people on a ventilator. In the ICU at this time, 48. And we can see for discharges, there are 60 discharges at this time. New York State for today, 1,059 COVID cases reported in the last 24 hours. Remember, does not include at-home tests or people who do not bother to test. And the increase for hospitalizations today was not higher than the peak of last week. This is some good news. This is telling me that we're probably going to get below 1,000, maybe at some point this week. Today they report 1,079 hospitalizations and 109 people in the ICU. I'm really confident that this level of hospitalizations will get below 1,000 either this week or maybe next week. All right, let's take a look at what's going on with Virginia. And you'll see here things are looking a little bit different. But take a look at this. Something that is different. A big change. The number of people that were in the emergency department and urgent care for COVID, 4,299. That's a big drop from last week's 5,165. Some very good news. Influenza. It's not very high at this time. You can see here it's actually low. Just 226 diagnosed visits for influenza. RSV did actually start to see a rise this week. One of the first rises of the season. And hang on, we actually have to switch this. It refreshed on us, just like the New York State dashboard always does. Let's take a look at the actual count here. And no, we don't want to see percentages. We want this to go to count. There we go. And now we can see what the actual counts are for RSV. Last week was 9. This week it's up to 21. Could that be the early stages of something? I suppose it could be. But again, it's very early in September. Come late September, October, yeah, we expect that will be going up for RSV and influenza. Remember, there are vaccines for all of these viruses. If you so should choose, get yourself, your family, and your kids vaccinated for these viruses. Alrighty, folks, that does it for the Tuesday edition of the Pandemic Update. We'll have another update again tomorrow. If you like this video, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and leave your comments down below. Remember, my website is datareport.info. I'm going to be doing some work on the website this evening before the debate. I do intend to watch that. But I am going to be doing some work there. I was alluding to a few COVID deaths from the past that should be added to the site. So I'll work to get that in there. And, I don't know, some other COVID studies. I want to work on COVID studies because there are some more respiratory breathing studies that I do want to add in there. I'll see you all again next time. Until I see you again next time, stay safe everyone and have a fantastic Tuesday afternoon. Thanks for watching.